Welcome to Get to the Root, the podcast that's redefining what health benefits should be. I'm your host, Dr. Erica Armstrong, founder and CEO of Root. Here we explore the category we've created, root cause health benefits, a smarter approach that uses advanced lab screening and functional medicine to reverse chronic conditions and lower healthcare costs. Each week, we sit down with forward-thinking employers, innovative brokers, and change makers who are transforming healthcare from the inside out. If you're ready to move beyond sick care and build a healthier future, you're in the right place. Let's get to the root. Welcome back to Get to the Root. I'm your host, Dr. Erica Armstrong, and this is a special episode because it's our 20th episode. And we have a special guest with us, Dr. Emily Cordes, who is our Chief Medical Officer, who is on our very first episode. So this episode is very fitting because we've been talking about how we help employers with real healthcare conditions and costs. And we're going to be talking about ROI and how we get there. And so you're going to hear it straight from our medical expert on how Root gets to real ROI for self-funded companies. So welcome, Dr. Cordes.
Thanks. It's great to be here. I'm excited to sort of connect the dots on how we actually get people healthy and how that translates financially for their employer.
Yes, thanks for being here. Excited for this talk. Let's start by kind of breaking down the current reality for most employers is that overall their healthcare costs are rising, often by 20% or more for fully insured this year. But the costs of, in particular, medications and chronic conditions continue to be a pain point for self-insured companies. So over the year, in evaluating the health spend for many of the companies in our pipeline, we've noticed at Root that the medications spend is typically 25 to 50% on average of overall healthcare costs, the majority of the time. We also continue to see that chronic conditions drive up to 90% of the costs. And that's in medications and specialist visits and procedures, et cetera. So Emily, can you explain how Root addresses the top 90% of healthcare costs, which come from chronic conditions and medication spend?
Yeah, I think it's important, just what you just mentioned, that it really is like chronic conditions that are driving employer health spend. Obviously, they have to pay for emergency services, right? But it really is the chronic conditions and it's the medications, it's the bounce around specialists, especially, right? So some of these chronic conditions, you can rack up easily 5 specialists and no one's really taking the responsibility to say, hey, like, let's actually figure out a way to get you healthy long term. It's just a bounce around. It's this ping pong ball around the healthcare system. And Root is designed to really like quiet that noise that you're not just a ping pong ball, you're a human in the system, right? And we try to not have you bounce around so much. I think it's important at Root that ROI, return on investment, is not just like a financial metric for us, right? And for the employer, it's real people getting real answers. Because honestly, like most employees, ultimately, they probably don't care about your ROI, right? They want to be happy, healthy, and not on a bunch of medications that have side effects. So when employees are healthy and happy, we also see employers that are happy because they do see that ROI. So twofold.
Absolutely. And employers love to have happy people that they work with as well. Yes. So I'm so glad you made that point. And the reason that a lot of these people bounce around is just the setup of the conventional healthcare system. It's very specialized and we still need our specialists, right? But the problem is when you have too many specialists and no one putting that picture together. So you've got a dermatologist for your skin condition, a GI doctor for gut health, a rheumatologist for autoimmune, when in reality, all of those things are connected by one or two root causes. And that's where the Root model of care comes in to break down this complex picture, use our tested protocols that are personalized, and put the picture together to give people clear answers and a clear path to that health ROI, ultimately leading then to the employer's ROI so that they can continue to support their employees in the best way possible. So let's dig a little deeper into what Root Care looks like. Root Support isn't just a web-based app or wellness only.
Right.
Yeah, of course, tech supports our scalability, but the quote human in the loop is really what drives the real change and accountability for the companies that we serve, where they have unique, real human challenges. Emily, can you talk a little bit more about these humans in the loop that you lead and how we actually help people get better and drive that ROI?
Yeah, I'd love to. So I'll first talk about like what our model looks like, but then I want to also put us like in the general landscape of employer benefits as well, because I think there is a unique aspect to Root. So Root is a doctor dietitian duo. We work together, and that the group of physicians at Root are also board certified, either family medicine physicians or internal medicine physicians that then went on to have further training in functional medicine. So, all that to say is that I consider us chronic disease specialists. We are trained to not only diagnose chronic disease and figure out maybe the immediate answer to it, but also to look for root problems that sort of brought us down that pathway to develop things like an autoimmune condition or a metabolic condition like diabetes, et cetera. So I feel like our team has both breadth and depth, and that's important when we talk about chronic disease. I especially want to stress that we do have registered dietitians that see all of our members. So it's not just a physician saying, oh, do this, do that, without the actual like boots on the ground guidance on how do you make that happen in your kitchen, at your grocery store, et cetera. I cannot do my job without RDs by my side.
Absolutely.
Yep. We're also just a proactive team that's going to actually engage your employees on getting blood work done and following up. So they're not going to be lost in the system. I find that a lot of people, they do want to get working on reversing their chronic condition, but life gets in the way. We all have busy day-to-day things that need to get done. And then sometimes people put their health in, in the background. Our team is going to remind them like, hey, let's get your labs done. Let's get you a follow-up. So we care for people pretty closely. Also, one of our big goals is trying to simplify the plan for somebody. A lot of our members come to us on many medications and many supplements, and they've been told to follow 6 different diets, and they all conflict. And they're seeing 5 different specialists. And I really want to decrease the noise for somebody to make it that their plan is doable day in, day out. So a lot of that just comes like one-on-one building trust with a member. And that's what our team is really an expert in.
Yes. That trust is such a key part of real accountability and follow through. And when you know you're going to check in with that same person, next month or
Exactly.
yes, they become a true partner.
Yeah, they do. They really do. I do think the fact that there is a human in it is, I know we're 2025, 2026, and we
Mhm.
think that like technology is the answer for a lot of things. And I think it is for a scalable to bring functional medicine nationwide. But they're really that human component is how we change disease. I think in the employee benefit space, there's a lot of siloed opportunities for employers to look at, right? And really, it's just a tech enabled conventional medical service, right? So,
Mhm.
like, traditionally, you think, okay, I've got my rheumatologist, I've got my gut doc, I've got my endocrine doc. And now we see it play out that now we have our GI app that an employer can buy for their employees. And then we have the hormone app, and there are all these apps, but like, gosh, that's a great resource, but we are not just an endocrine system and we are not just a GI system. We're whole human beings, and we need to be looking at how all of these systems interact and how they affect that individual's day to day. So I just don't think an app is the answer. Sorry to go on
Yeah.
a bit of a rant, but
And we're a tech enabled company. And
we sure
obviously,
are.
that's very important to us. We would not be able to scale nationwide without our tech and Root OS.
Yes.
But the important thing here is the thing that drives ROI and the nuances that you pick up from knowing a human to human and that connection.
Mhm.
And that's something that will never go away. And the ROI on real sustainable change
Mhm.
instead of, the conventional model of continuing to just manage something. So if someone has autoimmune disease, and the conventional thing is the standard of care is to just put them on the right med, find the right med for this person, and then continue to monitor it until they need an escalating dose or a new med. And you just manage it year and year. And when you have the root model of care, you think to yourself, wait a minute, what was actually the trigger for this autoimmune condition?
Exactly. Yep.
Was it, the gut lining? where a lot of autoimmune conditions can begin with the immune system, 70% of it being there? Or was that coupled with an imbalanced hormone? As we know, most autoimmune conditions start with hormone change, either postpartum or in perimenopausal years. And so, who in the conventional model can say, your autoimmune condition is related to hormones, and I know how to treat those, and also your gut health, and I know how to treat those? And
Yeah,
that's where root doctors come in as that chronic condition specialist.
exactly. Yep.
So let's translate this for an employer perspective, the stories that make it real. So we work with all different types of industries, from construction, manufacturing, distribution, engineering, public workers, teachers, all different types of companies. And they all really have similar issues. So when we work with a company, we actually help, we're wide enough for the entire organization. Everyone will get clear answers and a clear wellness plan forward. But the reality for ROI is we only really need to have huge success stories in 1 or 2% of that population to drive that ROI. Emily, can you talk about some of the things that we do at Root that, typically are very expensive without Root, and that's why we don't have to have success stories? Of course, we will have more than 2% success stories, but how will we get to ROI in our Root model of care?
I would break it down into 3, maybe 4 categories of where we really see the ROI play out. And I've touched on a few of these, but to delineate, it's the early access to the Root team, meaning that we are not a referral solution that they see us 6 months later. That when you start with Root, you see us within 2, 3 weeks and we get going on things. We're not going to delay for disease progression. And that really does prevent it prevents high cost events. So when people are delayed in a system, they end up having a flare, ending up in the ER, but ER urgent care, bouncing around to immediate solutions that don't actually help the chronic disease. So it's accessibility. So that's
Mhm.
number one. Number two is going to be that we discontinue high cost medications. Now, not everybody who comes to Root is just automatically taken off of their med. And we'll talk about that in a minute. It's only when it's like medically appropriate and when the member is actually ready to. So we don't just like blanket take people off of meds, but it's really the autoimmune medications and the GLP-1s. And those are also the meds that are usually the high cost meds when somebody looks at a employer's spend per year.
Without a doubt, the top 5 or even top 10 are either GLP-1s or autoimmune meds. Sometimes there's a migraine med in there too, which we can
Yeah.
help with.
Yep.
Mhm.
The migraine meds, those are getting pricey. Yep. And then number 3, like I've mentioned previously, that specialist bounce around is really, it stopped mainly. And I think the more I think about this, it's because our length of appointment is 45 minutes and the average primary care is like 7 minutes. So when our doctors sit down with a member, we really can think. We can actually have time to think.
Mhm.
It,
Important.
yeah, I know, right? Instead of being like, well, it seems like you have a gut problem. There's a gut doctor for that.
Mhm. Yeah, which, even though we treat the same conditions as a primary doctor, we end up
Yeah.
referring out 30 times less
Yeah.
because part
It's
of that is time to think, right?
the model. We have time to think. So referrals are just very low. So less specialists bounce around. And then 4, I do think there's ROI here. How I quantify it is a little hard, but it's that strong relationship component. It's the fact that employees have a strong, trusting relationship with a Root doctor and dietitian. And how to quantify that? That's hard, right? But there are obviously like great studies that show a good doctor patient relationship is the key to healing. So that's number 4.
Yes, absolutely. That continuity, which is unfortunately missing a lot more, even in your own primary care office and seeing the same person. And you might be wondering, like, how does Root do this at scale? Can they take on my thousands of employees if they're spending 45 minutes with them? And, part of that is like triaging people into the right level of care, right? Everyone will get clear answers and clear guidance right up front. And the second thing that I'm remembering we had a comment about this week is coming in with the right data. So when you come into Root, you're not starting from scratch, even though it's the first time we met you. We've already got really important data, including objective lab data that we can use to give you answers right away and get you started. So not only are you not waiting 6 months to see a specialist, you're coming in with the right data and you're coming into the right people who are equipped to handle not just one of your concerns, but really almost all of them,
Mhm.
in a very supportive care model.
Yeah, it's
So
pretty.
let's break this down a little bit more as far as like we mentioned some of the expensive things we help with, like autoimmune meds and GLP-1s. How would you break down, let's say we need to get a success story for 1 or 2% of the population? What would that look like for a company?
So, I think of a company that's about 400 people, and we see companies that are smaller and much larger than that. But for 400 people, really to see a good ROI, we need a couple people. So, two folks coming off of autoimmune medications, and we can talk through what that looks like clinically in a minute. But in this cohort, 18 people reverse the need for a GLP-1 medication. That's pretty unheard of to reverse that. Three people reversed overt type 2 diabetes. A lot of that work is seen in our, nutrition program with RDs. Two people reduced or eliminated migraines. And then really that 30 times less specialist bounce around, I think, is also where we get there. So even though we only need like quote 1 to 2% success stories, this is obviously more, right?
Yes.
So yeah. And that's
Yes.
in
Also,
1 year.
yeah. So many costs associated, like type 2 diabetes. I think the cost on that is an average $19,000 a year. Or with migraines, it's, ER visits and IV medications and daily medications and neurology visits, sometimes MRIs and
And lost.
invasive procedures even. And lost work. Yes, we didn't even touch on that because
I know. That's not even in the ROI is like, okay, so yes, this is the medication spend, but the ROI of like, oh, I have to be off this afternoon because I need to make it to this appointment, or I have to call off work because I'm in a migraine. Like that is how do you capture that ROI? But we see it in action. So
Mhm, we do. Yes.
yeah.
Let's talk about this clinically. Maybe an autoimmune slash gut health case. Emily, could you kind of walk us through what like a typical root member would experience and how we put that picture together?
Yeah, yeah. So I'm not going to talk through like one specific person, but I can think of a sort of a generic pattern that I see is folks who come to us with an autoimmune gut condition. So examples would be like Crohn's, ulcerative colitis, celiac disease, etc., collagenous colitis. And those folks usually have a diagnosis from a GI doc, from a scope, a colonoscopy. And after their colonoscopy, they're put on a medication to hopefully get them in remission, which sounds great if it stopped there. But a lot of these meds, people don't tolerate well. They don't feel great on the medications. So even though it's helping their bowel disease, overall quality of life is not amazing, and they're wondering if there's other opportunities there, right? So over the course of, 6 months is probably the earliest out to a year. Those folks work with a root physician to actually figure out why they ended up with this autoimmune gut condition in the first place and sort of can we walk it back. So they're going to work through gut lining healing. They're going to work through any food sensitivities that they've developed that have gotten them down this road. The big piece, as Erica mentioned earlier, is like, is there a hormonal piece? We know that there's a huge spike in autoimmune problems after pregnancy and then the perimenopause years. And if can we correct that so that they eventually can start weaning off of their autoimmune medication? And really, we don't take people off of meds. We actually get people to the point where like their symptoms and their labs look so good that then they meet with maybe their gut specialist and they say, well, why are you even on this? Everything looks so amazing. And usually their GI doc and the member actually take themselves off of the medication. They still work with the root team so that they don't have to bounce back to a specialist and that we keep them, that their labs and their symptoms are looking good. So it's really never like us being like, oh, you should just stop it without anybody knowing. People
Mhm.
want to come off of meds and we get
Yeah.
them to the point where they have a successful launch.
Yes. Very important that we help keep them in remission so that they are successful and resolve root causes.
Yep.
And that's a really excellent point that they want to come off med. People ask me this, do you take them off or do they want to come off? Nobody wants to be on an autoimmune med. They sting, you have to go in every 6 weeks, there's side effects, gut side effects, fatigue side effects. And of course, like we need them. And a lot of times they do improve quality of life, especially before we've reversed root causes.
Right.
So that's why it has to be very clinically monitored. And medication prescribing and deprescribing off ramp, that's medical management. And
Sure
so
is.
it's very key that we have a doctor who is supervising this and checking in
Mhm.
regularly. And the communication and the dietitians check in. They have a direct line of communication with the doctor who's their partner. And that part of our model is really kind of the special sauce since day one is that real care team that has time to talk about you
Yeah.
before there's a big issue
Yeah.
proactively.
Yeah.
Yes. So let's, in closing, why this matters. No one can deny that healthcare prices are a threat to businesses and thus the employees that they employ. And companies need a sustainable solution that they can easily implement, something that can come in and make their employees happy and at the same time reverse their conditions, improve their overall health while providing an overall ROI so that they can continue to offer really great benefits
Mhm.
to their team. Any last minute thoughts from you, Emily?
Yeah. Yeah. I think healthcare is complicated. I know that's like a huge understatement. I think when an employer works with Root and their employees see that we cut through a lot of the noise in healthcare. We're a resource for employees that are struggling with chronic disease. We stratify sort of like where are people in the chronic disease spectrum? Do they need to work with a doc? We get baseline labs before they even see us. I think we really cut through a lot of the noise, which decreases burnout for employees.
Mhm.
So we're excited to be a resource as employers look into different options.
Yes. And yes, I like that you ended with a resource. We don't replace the primary care solution. Most of the time, the employer already has one of those. We just layer in right on top. We can be that resource for your primary care team and for your people that need someone to help with their chronic conditions. So, with that, if you're interested in working with Root, check out our webpage. We have a for companies page and a contact form to book a demo. Thanks for listening. Till next time. Thanks for listening to Get to the Root. If you enjoyed today's episode, be sure to subscribe and share it with someone who's ready to rethink healthcare. You can learn more about Root Functional Medicine and our work with employers at rootfunctionalmedicine.com. We'll see you next time, where we'll keep challenging the status quo and getting to the root of what really drives better health.